at least a little longer. But this slide shows that that's not the case. That United States, I think, ranks about 11th in length of life expectancy compared to countries around the world. Next slide. And the previous speaker talked about healthcare disparities, and they show up, and they're not so clear in this summary chart because this is life expectancy at birth, and you see, but there are differences. And I also think you have to know that there have been improvements in life expectancy among blacks and Hispanics over the past 40 years. Next slide. The healthcare industrial complex, as I call it, again, I mentioned earlier, you can look at the payers, and we have a very complex system of how we pay for healthcare in this country. The federal government, state governments, Medicare, Medicaid, combination federal, state, the private health insurance industry, the private payers, and self-insured companies and individuals. So we've got this mix of people paying for this stuff. And they're paying providers. And the providers are hospitals, begin to make up about 38% of healthcare expenditures. Physicians, about 24%. Big pharma, about 11%. And the nursing home industry at about